Hello, everyone, and thank you so much for joining us today. My name is Sayram Dordor. My pronouns are she, her, hers, and I will be your moderator for today. I am a policy associate with the International Center for Research on Women, ICRW, and I'm very excited to kick off this panel as it's been a conversation I've been looking forward to for quite some time. So today's event is titled Racial and Reproductive Justice, Key Components of Global Sexual and Reproductive Health and Rights, or SRHR. If you have any questions during today's conversation, please feel free to submit them in the chat or the Q&A function at the bottom of your tab. Our team will be collecting questions for the audience Q&A portion at the end of this conversation. And this event will also be recorded. So this event is a part of a launch for ICRW's newest brief on the linkages between SRHR and racism and colonialism. And so today's conversation will be building off of that brief and is especially timely in a world where we're seeing reproductive rights being increasingly politicized and polarized, as we saw last week in the Supreme Court and globally through various restrictive abortion policies like the Helms Amendment. And so today's speakers will be touching on how we can address the harms of the past and present by using a reproductive justice lens. So you may be wondering, what is a reproductive justice lens? So the term reproductive justice was coined by 14 Black women in 1994 and is defined by the sister song Women of Color Reproductive Justice Collective. Reproductive justice is 1, the right to parent, 2, the right to not parent, and 3, the right to parent children in safe and sustainable communities. It ties together multiple movements like the racial justice movement and also looks at the structural and systemic causes that shape our access to sexual and reproductive health services. It takes more of a holistic approach and looks at communities and kind of ties in together all of our needs and wants and centers everyone to achieve true sexual and reproductive health and rights and justice. So while ICRW is not a reproductive justice organization, I'm really excited to highlight today's speakers who work from that framework and have us discuss more of what a reproductive justice lens looks like globally. So now I will introduce our speakers. First, we have Lienna Feleke-Eshete, who is a senior program associate for the Transnational Birth Equity team at the National Birth Equity Collaborative. Then we have Catherine Nimbrua, who is a consultant in global health, SRHR, HIV, women's rights, and youth advocacy. Then we have Dr. Annabel Sowemimo, who is a sexual and reproductive health trainee and founder of community-based organization Decolonising Contraception. And so Decolonising Contraception is a community organization formed by Black and people of color working within sexual and reproductive health who wish to address the colonial history of sexual and reproductive health. So without further ado, we'll jump right into today's chat. And so our first question is, could you all please introduce yourselves and what reproductive justice means to you? So first we will start with Lienna.
Hello, everyone. Such a pleasure to be with you today. My name, as Sayram said, is Lienna Feleke-Eshete. My pronouns are she, her, hers, and I am Senior Program Associate of Transnational Birth Equity at the National Birth Equity Collaborative. I'm a first-generation Ethiopian American, and I've worked in politics and policy for the last 5 years, specifically in reproductive justice and reproductive rights. So to me, reproductive justice is the way to liberation. It's a cross-generational, cross-subject movement that focuses obviously on freedom of reproduction and reproductive health, but also freedom from other intersecting issues such as climate change and climate disasters, food injustice, colonialism, capitalism. And what I love most about the reproductive justice movement is that it allows you to show up as your true self and as the person that you are in all of your intersecting identities. So oftentimes with the white feminist movement, Black women or women of color are told to abandon their race for the purpose of white feminism, for feminism. Reproductive justice says show up as you are. And also oftentimes in racial justice movements, Black women and women of color are told to abandon their gender for the sake of the achievement of that movement. So that's what I love most about reproductive justice. And I'm really happy to be having this conversation today because I think it's really important and grateful to ICRW for doing this.
And thank you, Lienna, for that great answer. So now we'll go over to Annabel to give us her answer.
Thank you very much for having me. So I'm Dr. Annabel Sowemimo. I'm a community sexual reproductive health doctor based in the UK and founder of Decolonising Contraception Collective, which is a collective that focuses on sexual and reproductive health needs of Black and people of colour. We were formulated born out of frustration, really, because we felt the narratives around sexual and reproductive health and why there are poorer outcomes for some groups was limiting. So in response to what reproductive justice means to me, it's really an opportunity and a framework that allows for a more expansive understanding of sexual reproductive health, which allows us to discuss bodily autonomy whilst also discussing the other forces and power structures such as racism, colonialism, ableism, that have and govern our day-to-day lives. It expands the idea of choice. Choice frameworks have been too limiting in that they don't account for who has choice and how we give rise to choice. So for me, it's also really, really important to understand a lot of the historical legacies that we have still deeply embedded within our institutions, giving rise to disparities within our policy and research and how we look beyond these things.
Thank you for that great answer. And so now over to Catherine.
Thank you so much, Sarah. My name is Catherine Nyambura. I'm calling in from Nairobi. I'm a consultant on global health, women's rights, social reproductive health and rights, and I've consulted for ICRW and continue to do so. And I'm part of many other feminist collectives like the Athena Network and many others, and really excited to be here. For me, what reproductive justice means to me is agency and most importantly, equity and humanity for all, especially women and girls and Black women and girls. And for me as an African feminist, African women and girls who are at the bottom of the food chain, so to speak. And just why this is important to me is because when people cannot make determinations about their bodies and choices about their reproductive lives, it kind of limits their engagement in other spheres of life, social, economic, political. And so there's a ripple effect. And finally, it's about politicizing our existence and being bold about the needs of African women and girls, Black women and girls, and being bold about what that looks like, but also situating that within other struggles. Other people have spoken of colonialism, capitalism, and how bodies of women and girls, particularly African women and girls and Black women and girls, are sites of these struggles, literally sometimes physically. So thank you so much, Sarah, and I look forward to an engaging conversation. Back to you.
So thank you all for those great answers on what reproductive justice means. And so now we're gonna dive a little bit deeper. And so over this question is for Lienna. And so wanting to touch on your expertise in international advocacy and foreign policy. So as the largest funder of global health and family planning, the United States has a particular role in advancing sexual reproductive health rights and justice. How can US foreign policy use the reproductive justice lens for aid, programming, and research?
Thank you, Sarah, for that question. There is a lot that the US government can do as one of the largest funders. The first thing is to design programs based on individuals' realities and needs as they tell you and not what you think is best for them. So I think a lot of the programs that the US has funded currently are siloed in a way that doesn't actually make sense when you look at the way the programs are executed on the ground. You might have one clinic that only does maternal health work, another clinic that only does HIV and AIDS work, another clinic that only does family planning work. And then when you think about the ability of the average person in that country to visit all three of those clinics to actually access the healthcare that they need, it's quite ridiculous. So I think one is designing programs based on individuals' realities, as I said. Second is abolishing foreign assistance-wide policies that are not based in evidence, research, or lived experiences. So I'm talking about policies like the global gag rule, like Helms, which you touched on before, and instead trusting the communities to use foreign assistance funding in a way that works best for them. And we know that all of these policies on abortion are not actually based in reality. They're based in partisanship and what the constituents of the policymakers in the US want. And that is not how we're going to achieve liberation in US foreign assistance. And then lastly, diversifying the workforce. And this applies to the NGO sector as well. We can't have leadership within US government that's full of all white people making decisions for predominantly Black and Brown communities and Black and Brown women. So we need to have diversification of experience, of people who are in the workforce, and hire local Indigenous experts, help them advance within the government, within the organizations, pay them equitably, and make it so that we have a US government or NGO system that looks like the communities that we are hoping to serve.
Thank you for that, Lienna, and especially hearing all of those great recommendations on how to kind of reframe or improve our current foreign policy. And so then I think building off of that point about thinking about how we can expand foreign policy, also want to think about how we can expand what we even consider as a part of SRHR. And so for my next question is directed towards Annabel. And so my question to you is, how can we better incorporate other aspects of SRHR like well-being and sexual pleasure in our advocacy on SRHR?
Great question. So I think first and foremost, we have to look at what sexual and reproductive health means and how we have come to a kind of conclusion about what is sexual and reproductive health. And we can't fully understand that without looking at the structures of the organizations that define what is policy, what is good SRH, and that's like the World Health Organization, and who has a voice in those spaces and whose research is drawn upon. And nearly always that's clinicians or people based in the global north, or people that have been educated through some of our leading public health schools, including myself, in the global north, and that have shaped their thinking. So when we look at what sexual reproductive health is and what is prioritized, even though in recent years well-being and pleasure have now become part of those definitions, they're still not fully centered upon. So what I mean by that, lots of people on the call that work in SRH will know that we focus on reducing STI risk. We focus on distribution of contraception because the targets that we make very much speak to the needs of those in the global north. Increasingly, we have a rise of, ecofascism. There's always been a focus on Malthusian ideas of we need to restrict populations because of resources, and that's always lacked a conversation on resource distribution, as well as a lack of conversation on culture. So whereas some of our needs from how we're socialized, we may say we want longevity in life, so we want to live to 80, but we would like smaller families, and we would like to go on holidays and things like that. Culturally speaking, that doesn't speak to the material needs of some other people. Some people have been socialized and they're happy to live to 50 with relatively what we might consider material things, but they want a family of 8 people, and outsiders looking in do not understand that framework of being. It's not of them, and they must think that they would want more things and to empower themselves. And I think we stifle, as Lienna's already said, a lot of these voices, and there is still deeply embedded in our practice these neocolonial ideas of what's good for people, and it manifests in our policy. So we do need to start having wider conversations about things like well-being and pleasure and what that means within the cultures people are coming from. I think there's also a lot to be said about the framing that poor people want their material needs taken care of before we can start considering pleasure. Whereas instead, we should actually think of pleasure as in itself liberating and a way of achieving, better life satisfaction, and that in itself being the end goal and not an add-on. There's a wealth of literature written about pleasure as liberating, particularly for Black and other marginalised groups, especially when you look at the context of how we're sexualised. So our sexuality is often, got to do with trauma, assault, or it's something that has been used within the capitalist frameworks for economic means, birthing more children for more labor and things like that. So pleasure in itself, as we know, is revolutionary, considering pleasure, because actually it historically there's not been given any space for us to explore pleasure, and it's always reproduction centered on trauma. So we do need to start thinking more about financing interventions that center specifically on pleasure and well-being, and it's not a tag on, because actually that in itself is a liberating force and an empowering force, and a way for people to free themselves from other things.
Thank you for that great answer, and especially thinking more about how we can better integrate other aspects like well-being and sexual pleasure. And so I think building off of that and thinking about what communities need, want to direct my next question to Catherine. As we're especially seeing since 2020, many organizations, including USAID, funders, and other NGO organizations that are thinking about or making commitments on localizing aid. And so my question to you, Catherine, is how can localization efforts meaningfully engage women's rights organizations and incorporate community needs and wants?
Thank you so much, Seyram, and thank you so much for those who've spoken before me. In terms of responding to your question, just to start by saying a lot of the agenda setting has been done by feminist networks and women's rights organizations. So by the time the governments are making commitments, there has been a groundswell of activism, and there has been a groundswell of creating visibility for some of these issues. And when the flip side is when the commitments are made, they rarely interface with those particularly resources. They rarely land in the hands of those who are the ones at the front lines of the activism. So for example, only 1% of gender equality funding goes to women's rights organizations in the global south. Yet these are the front line, what you call the front line of some of this agenda setting, and what, when you go for a conference, you will find the faces of the issues we're speaking about. If I am an Afro-Kenyan girl going to a global meeting and somebody is speaking about lived realities, they'll often be speaking about a Fatima from Nairobi, or from Nairobi's informal settlements, or somebody else from a village in Samburu, but rarely does the women's rights organization or the community group in that setting qualify for the kinds of these grants that drive these kinds of initiatives. So one, to answer your question, we need to have trust-based engagements with women's rights organizations. So when we are putting out commitments, including in foreign policy and such difficult settings, the average women's rights organization from AWID's research a few years ago only operates with $20,000 for their annual budgets, and rarely will they have core funding. And so it shows you that even though folks that are at the front line of agenda setting, activism, and putting sometimes their bodies at risk, women human rights defenders, they rarely control the resources. And when they do, they rarely control a chunk of it, just the measly ones. And so it's important for us to be investing from a trust-based perspective, where when we are investing, it's not just in programs, but also in institutions. So ensuring that we provide for support for these organizations, for them to exist, for them to be able to run their programs, for them to be able to be building movements, for them to be able to be continuing to engage in meaningful ways beyond operating from program to program. That's number one. Number two, it's also important for us to build on the activism and existing systems built by these folks. Oftentimes when we get funders committing or putting out calls for applications, it kind of shifts the priorities for the folks who are applying to define their work in this narrow lens that has been set by the funding call. And that kind of limits, that kind of is counterproductive, because funding should come to do better. We always say we should be working ourselves towards the system, but most times when we have to find folks who understand how to frame these grant proposals, rarely they're not the women's rights organizations themselves. I have worked for women's rights organizations that they cannot afford to employ a grant writer. And so what does it mean? the INGOs, the folks who have this capacity, the folks who have this luxury are the ones who will be able to get the grant. And then if they do so decide, then they can re-grant to their community groups. So I think there's an issue of equity there for us to discuss. There's an issue of how to approach grant making and any kind of interactions from a trust perspective, but also building on systems. I think for funders who have invested in grassroots organizations, there has been returns, there has been progress in that way. And I think finally, to just respond to you, I think it's finally important for us to be putting those folks as the experts in designing those grants alongside, the USAID experts, because rarely will they be interacting at the ground. And now with COVID, we rarely even have them coming to the ground to even see how the community programming is going on. So then if you don't trust in building the systems you're trying to change, it will be difficult for us to move forward. Thank you.
Thank you, Catherine, for that great answer, really detailing about how we can build up systems and trust-based funding. And so for this next question, it's directed to all of our panelists. And so a common pushback that we see oftentimes with talking about using a racial justice lens or even talking about race in global health is that race is perceived differently globally compared to the United States. And so the question is, how do we adopt a racial justice lens while also being culturally sensitive to country context? So first we can direct it to Lienna.
Yeah, I think that's a great question, Therum. And I think it goes back to my earlier point of listening to and programming based on local country need, and also based on what people express as their issues in their community. So I know that anti-Blackness is a global phenomenon, even though racism in the US and the history of racism in the US might be different than the history of racism in any other country. I think that if we are grounding ourselves in what the community is telling us, and a lot of the systems are very similar, they might be focusing more on colonialism and fighting back the impacts of colonialism versus in the US. But that's actually a lesson that our team at NBEC needed to learn, where we were focusing on a program that we were going to implement transnationally. And when we were speaking with individuals around the globe, we realized that we were coming with our US-based understanding of race, and that we were perpetuating some of the same harms that we were trying to work against, even though our team is made up of all Black women. And so we had to take a step back, humble ourselves, have that cultural humility, and listen to what some of our partners around the globe were saying they needed specifically in terms of this program, and readjust. So I think the cultural humility, the listening, is just a very important value to have throughout all of the work.
Thanks for that, Lienna, and especially providing kind of a learning lesson from your own actual programmatic experience. And so then we can go to Dr. Annabel.
Yeah, thank you. So again, a really great question, and a topic that I really welcome, because I think we can't really have reproductive justice without talking about imperialism, and specifically also American imperialism, and what that means when we talk about race. So in many respects, like you saw with the BLM movement over the last few years, a lot of those concerns will resonate globally and also spur lots of Black communities, but also a lot of other communities that face oppression into action, and they will relate to some of the demands being made and some of the problems that people are facing with the state. So there will be some universal experiences that translate and that we can use when we're forming coalitions and working on certain issues. That being said, we also have to acknowledge some of the damaging effects that American imperialism has on our policy and our research. So what I mean by that is, when we look at science research, a lot of our research, even in SRH, comes out of a few countries, and when we break down groups into racial categories, which we know in science doesn't really obviously have meaning in the way that it should, people use it to have meaning. A lot of these studies are done on Black American populations, and people will say, okay, well, you know, this happened to this many Black Americans, and then they'll take that research and they will use it in the UK, they will use it in other countries in Europe, they'll use it, you know, across Africa, and say, well, you know, Black people have high blood pressure because this population in this city in America had high blood pressure. And we see it repeated again and again and again. And these things are very harmful. In terms of, it's not specific, it's not scientifically sound, and we see this replicated again. So we do need to have deeper conversations about what this means when some of this science and this policy as well, because we have the same issue in policy. People will create policy around the needs of a Black American experience and then disseminate it and think it's applicable to all people. And what that means in terms of silencing other populations, and what it means to, you know, create a global idea of Blackness that actually often centers on an American idea of Blackness, whether that's in films or movies and those dominant things. So there's definitely it's going to be very difficult to achieve reproductive justice on a global scale if people aren't willing to have a conversation about American imperialism and what that means for other people and some of those harmful effects. But as I said, it is very important that we also understand that the idea of Blackness and the phenomenon of Blackness in relation to white supremacy was made to put a whole group of people within, you know, the same box, and it reduces our experiences. And there's power in saying, okay, we're racialized as Black, and that has a lot of meaning in terms of what anti-Blackness and anti-Black racism is, and investigating those experiences and pushing against that. But we also have to say that in itself was something that was forced upon us, and we need to start understanding the diversities of experiences cross-culturally from country to country, or we're never going to be able to overcome some of the problems that we have.
Thanks, Annabel. And then over to Catherine.
Thank you so much. I think for me, my response to that is a lot of the approach is mostly driven by oversimplified narratives about African people. So for example, I'm from Kenya. In Kenya, we have 48 tribes, and I'm just from one tribe. I wouldn't feel as an expert to go in some tribes and drive programs on certain things because I will not be the right person, even though I'm Kenyan. Can you imagine X person from Norway doing that and then going back to advise their government on funding in that regard? That's the reality of how programming happens. And so I think oversimplified narratives do have effects as to how some of the nonprofits with which we work in the nonprofits gets replicated and reinforced. And it's really a show of, as Dr. Annabel has said, who sets a narrative and who ends up writing that. I think for me, it's important for us to shift away from that oversimplification of narratives of any kind about Blackness, about African people, about sexual reproductive health and rights. For example, even in discussing SRHR, we have issues that are more hierarchical than others. So it's easier for us to discuss family planning as opposed to discuss abortion rights. That's a much more safer topic if you're discussing that in a policy setting or negotiations in a UN room meeting. And so I think that impacts the ways in which people access their rights, and that continues to, one, reinforce some SRHR issues as more important and accessible for African people or Black people as opposed to others. That's number one. And then secondly, is not one size fits all. I think that's the approach for sensitivity and cultural context taking. Because if you come into working with even just governments, engaging governments, even just African governments, you have to understand how they work. Engaging the US government, I have to understand how that works. And I think finally is the issues of the global South and how race manifests here. It's in terms of tribes, right? Social norms and etiquette, right? And how you come to a room and how you engage the room. So if you're in a room engaging African women on maternal health and you are a man and they will, of course, probably not engage, or they'll tell you what you want to hear, and then you go back with, biased information or not the correct information. So I think reading those kinds of nuances and being mindful to those, and programming and taking those issues seriously is critical. And I always say that let people who are most affected and most impacted be the leaders, not just in terms of programming, but also in setting the agenda, in making the decisions, in driving. So if you really are an ally, I think there's a place for discussing how you interact with communities from that perspective. And this really is one of the grounds for practicing that and advancing that.
Thank you all for those great responses, and thinking more about how we can kind of add more nuance in how we are approaching our discussions around racial justice globally. And so for my next question, I think building off of that, and especially having more conversations, and I think really honest conversations, how can US-based advocates meaningfully foster transnational solidarity and build relationships with like women's rights organizations, youth networks, and other movements in other countries? So whoever wants to take the first stab at that question?
I can go first, just keeping with the pattern. So I think first step is recognizing your positioning. So as I talked about NBEC's learning experience, we are an organization of predominantly, mostly Black women working in the US, and we all come from different parts of the country, parts of the world, but we also recognize that, again, we're an organization working in the US. And so we have access to donors, and we have access to funds and other privileges that we need to utilize our privilege to leverage. So one of the ways is by sharing resources. Oftentimes, if you go and you do a program in a particular country, you'll provide a stipend for the work, but that's not really a long-term solution. And so instead of doing that, we can connect organizations, our partner organizations transnationally, directly with funders that we have access to. And that is a long-term way to share power and share resources. Another thing that I think oftentimes US-based NGOs don't pause to consider and reflect on is whether they are the best actor to do the work that they're aiming to do. And sometimes it means saying no to funding and removing yourself from the equation, and instead providing that funding to a organization based locally that has more knowledge and sense of community to be able to do that work in actually a transnational way.
I can go next. Yeah. I do think there's value in terms of us understanding the spaces that we all occupy, and there's really value in transnational solidarity. So I think the first thing that of support to me is passing the mic. When you truly feel you're not the right person to be representing a certain community, I think that then pass the mic. And I think that's a way of creating space and sharing the space meaningfully. And then secondly is opening the doors and sharing the access. I know, for example, I first came to DC for an advocacy meeting because a US organization did bother to engage some of the communities from where I was, to engage at the Hill and be like, this is how you program for adolescent girls and young women, and this is how you design programs and structure the resources. So I think it's important to open the door, pass the mic, very important, because at this point, I probably don't know which doors I should be knocking at to start with. So it's important for somebody to be keeping those doors open. So there's value in that. And then there's also importance in helping folks understand how the US foreign policy space works, the timelines for things. I think it's like any other government space, it's complicated, it has its mechanisms. And so if once you get people into the door, support them to engage, support them to meaningfully contribute, support them to be, to navigate the system. I know it's hard when you feel like the meeting is victimizing them, put them in the right rooms, don't reinforce those narratives, don't put them in spaces where you'll be reinforcing stereotypes. So I think it's really critical for that. And finally, is just flag opportunities and entry points for engagement so that you can also, I think, for them to bring other people. I have seen, for example, US folks really help African-based organizations understand the PEPFAR process. Most of us wouldn't be able to understand how that works, right? Because you're not physically based in DC and you don't know how things, the mechanism of the background. And I'm speaking as from an advocacy perspective, because that's how really things get done. And so I do think there's practical ways and tools to do this. And also finally is when you are in the US and you want to work on the continent or outside of the US, work with the experts in those countries, right? But you're striking a balance. You don't just open the door and then still keep being the experts. So you don't assume that because you open the door, then you have the right of, controlling all the resources. So I think it starts from simple things like opening the door, supporting everybody to stay engaged, but also doing the work to continue that sustenance. Because I don't believe that solidarity or transnational support is just a one-off thing. It's a relationship building kind of engagement, and it takes a long time. And it's the trust process that needs to drive that.
So I think both Catherine and Lienna have said, much more and very comprehensive answers. So I don't have huge amounts to add, except to say, I think fundamentally resource redistribution is key, because a lot of resources concentrated in one place, and it's not that people are not as good as you or as articulate as you or don't have the skill set. It's that they don't have the resource and the support that they need to get on and do the work. So I think giving people the resources to get on and do the work and fix or create solutions to the problems within their area, which you may also benefit from through partnerships and coalitions on certain issues, I think is really, really key. So I can only use our own experience, kind of being a small grassroots organisation and being assisted with larger organisations, and we would not be able to have got this far or even lasted this long if people didn't actually say, wait a minute, we have a lot of resources. Our donors keep giving us a lot of money because they don't know about these other smaller grassroots organizations. Actually, we are going to transfer some of that or trying to support you in some way. And that really needs to happen on a mass scale, not just on a local level. I think there is something about being humble, and I'm still learning, and I still learn about other people's work on a day-to-day basis, or a weekly basis rather. I'm not always, I scope around and look for organizations that are already doing that work, but you miss some, you may have overlooked somebody's work, but there's something to be said about not reinventing the wheel, which has already kind of been mentioned. So don't redo things that have already been done. Really try to see if you can find organizations that are already experts in that area, and really just humble yourself and say, I'd really like to learn from you, and form partnerships. Ultimately, we're not going to get out of some of the situations that we find ourselves in where there's really poor health among some groups, both locally and globally, unless we form coalitions. It's not going to happen.
Sarah, if I could just jump in, I have one more point to add that Dr. Annabel reminded me of. Language justice is such an important aspect of this conversation and transnational solidarity. We can't have conversations if we're not speaking the same language, if we're not understanding one another. And that's a pretty basic thing that I think a lot of international spaces and NGOs don't account for. And expecting that everyone's going to be able to speak English is a colonial imperialistic value, and also just keeps a lot of people who need to be in the room out of the room because of a lack of education or ability to speak English or whatever it may be. So I think language justice and adopting language justice as a value is a very important tenet to transnational solidarity.
Yeah, thank you all for those phenomenal answers on thinking about how we can build a better transnational SRHR movement. Really enjoyed hearing that. And then I think building off of not just transnational, but thinking about working across different movements. So I think especially in a lot of the definitions that were shared, a lot of you all touched on how you have to work across different movements to kind of achieve this goal. So my next question to you all is, So how can we work effectively across the SRHR sector and across other sectors with researchers, practitioners, funders, member states, and other stakeholders to advance this vision of racial and reproductive justice? And so I will first direct it to Catherine.
I do think, and to add on to the language justice issue, because of how we all learn English is my third language, for example, in spaces of international development, the expression as well beyond, I think there's also the need to decolonize some of the language, that if I'm not expressing myself a certain way, I'm not communicating, or I'm not communicating at an expert level. That's really also important to understand, that some of the language is not accessible to all people. Even though I speak English, I may not feel competent enough to call myself an expert, because that's not the kind of English that is acceptable in that space, or in terms of framing that subject, or in terms of being a thought leader on the topic. So I do think that the language justice really trickles down in terms of even how English in itself has versions of it. And for example, if you're discussing policy language, it's quite a difficult realm of understanding and discussing and even just expressing yourself. So just beyond English, just also being mindful that the ways in which I want to express myself to an American audience as a Kenyan, people will be like, what did you say? I have an accent, I acknowledge that. And I probably may be a very well-spoken Kenyan, but still my language may not be audible to an American audience as it will be in other spaces. And that also limits access to global spaces, for example. And so you find most activists remain grassroots, because then that's a level which they have been relegated and they cannot go global. That's just, I wanted to add on that. In terms of the question you asked, Sarah, I think we have also tended to elevate aspects of the work over others, right? Sometimes you pit advocacy against research, you pit communications against advocacy, and that really depends as to where the resources go. And I think it's important for us to be mindful that for us to advance the work, we need to be holistic in investing in all aspects of the work, both organizing, programming, research, advocacy, because I do find, so for example, looking at US foreign funds, a lot of that goes to service provision, right? And that means counting numbers, and that's really what is a certain way of doing things. And then if you're looking for funding for advocacy, it's not as much. And so it's critical for us to be holistic in terms of how the resources are distributed, but then also finally is weaving the issues across all the sectors of the space. So I don't think that SRHR should just be discussed in the health space. It's also an economic justice issue. For example, even just the cost of contraception and how that is accessible or not, or affordable or not, and how the investments in that sector are not driven. You know, I think it's a much broader discussion. So expanding the frame and being more intersectional, and also just being mindful that we don't limit the SRHR discussions and the racial discussion just into one sphere. As we all discussed at the beginning, it really links up with neocolonialism, imperialism, and these are emerging issues. And with COVID now, there's a lot of reprioritization. So even just the discussion is becoming more dynamic. Discussions of equity, discussions of access to resources are becoming more dynamic, and we are seeing a place where things are being, the structures in the health system mean that the least priorities will go to things like HIV, SRHR, maternal health, and things like that. So it's really critical for us to have a much more broader frame and be mindful of not elevating other aspects of the work over others.
Thanks for that, Catherine. And so next we'll go to Dr. Annabel.
Thank you. So I think there are some things that could potentially be done. So in terms of when we think about how medicine and some sectors have come into being and how they looked historically versus now, I think we had a lot of individuals at the beginning that were what you call like polymaths, right? So they did a bit of biology, they did a bit of economics, they were also, they did some things around law. You know, if you look at kind of how individuals that were considered academic or leaders, you didn't have one lane that you stayed in and you were confined to, and that was socially okay. It was understood that people had multiple disciplines. And I think when you do look at communities that are marginalized, particularly when you look at their leaders, and they do end up starting to do lots of different things because they're forced to. Somebody comes to them with another issue and then they put on another hat. And I think sometimes we're taught that that is a negative, right? You can't be a scholar activist. Your lived experience clouds your research. Or you can't do that properly if you're also doing this. But I actually think that this is some of breaking down colonial modes of thinking that have tried to maintain dominance or power in a certain area. Sorry if this is not as coherent as it could be, but I'm kind of also thinking things through on the spot. So I think part of trying to undo some of the power that is in certain areas is about people becoming literate in more and more realms so they can have joined up thinking, as Catherine said. So you can challenge on multiple fronts because you understand the economic argument, you understand the health argument. And I think our literacy in certain fields is limited. It's limited by time, but we're also told by a very structured education system that you only can focus on one thing. You have to choose a discipline, right? So if you're a tech specialist, you understand tech, and you might have health tech, but it's all very niche. But I think we need to build leaders and build people that are interdisciplinary, can understand an issue from multiple vantage points. And I think that will build better solidarity and better solutions to some of the problems that we're facing. And I think it's quite purposeful sometimes that people are told to stay in a certain lane. So actually, you can't possibly understand the economic argument. You're not an economist. Well, actually, there are people that have much more comprehensive arguments about certain aspects of health than I do, and they're not from a health background. They've just done the reading. And this is another issue with colonialism, that we're told that your expertise only matter if you've been educated at certain elitist institutions in certain spaces. And grassroots, street activists are told that their problems don't hold, their answers or solutions don't hold any weight because they don't have the academic understanding or the pieces of paper, and they don't have that meritocracy around them. So I think if we're going to start building solutions that are interdisciplinary, we really need to start shifting people's ways of thinking about education as well, and who gets to develop solutions in these spaces, and whose expertise holds value.
Thanks for that. And then now last with Lienna.
Thank you. I agree 100% with what my colleagues have said. And I can speak to it in the US space, I think, because we're oftentimes coming from a place of scarcity of funding and having to fight for funding, whether we're talking about US government funding for various areas, or we're talking about big donor funding. We have this sense of competition that inhibits our ability to work across areas. So the racial justice folks don't want to work with the abortion justice folks because they don't want to be tainted by abortion politics or whatever it may be. And I think we really need to abandon that false sense of competition, because it is purposeful and it is hindering our achievement of liberation or whatever the goal is ultimately. And secondly, I think that donors have a lot of work to do in setting the expectations for organizations. If the donors were to say, we're not funding any organizations that don't have a racial justice lens or aren't working in a meaningful manner with racial justice organizations or climate justice organizations or whatever it may be, we would actually see a shift in the prioritization of racial justice and climate justice within NGOs based in the US. And so I think that donors need to step up in that manner to set the expectation and set the agenda, and then hopefully the NGO sector will follow suit.
Yeah, thank you all for those great answers. And so now we will pivot to audience Q&A. And so thank you all who have been submitting questions in the chat as well as in the Q&A function. So the first question from the audience, and I think is especially relevant, is how do we reconcile with the historic and existing instances of reproductive oppression, especially in communities of color, while also advocating for ethical access to SRHR services and resources?
Yeah, so I think that centers quite a lot on the work that I do. So I very much use the history of subjugation amongst Black, Indigenous, and people of color. And some people have made comments in the chat about language, and I think language is really important. And I say that you have to be specific depending on the issue you're talking about. So, you know, my language changes as it should depending on the issue I'm focusing on. So when I'm talking about subjugation under the guise of like white supremacy, then I often use Black, Indigenous, people of color, because that's the historical lens under which they've been subjugated through colonialism. And I'm talking about multiple different groups of people. I'm talking about a specific experience, and I use that specific group of people. So, you know, I'll say Black Zimbabweans, for example, and I think you need to be specific as possible in your language. So in terms of using our histories, I think it's actually really important, because I think there's this idea that we never go backwards, the idea that progress is consistent, and that with sexual reproductive health, access, equity, rights, that we can't regress. So I think it's very, very important that actually we use that history as the foundation of our advocacy, to say, actually, these are the many ways in which our research and our knowledge production have been unethical, have not served certain groups of people. We are not looking to, you know, to embody victimhood. That's not what we're doing. What we're doing is raising really valid points about how we've been subjugated through medical sciences and through colonial exploration, and we need to make sure that these things don't keep happening again in our policy, and people don't keep altering their language to do these things again. And a case in point, and it's coming up more and more, is when we keep looking at climate change arguments and environmentalism, it keeps gearing towards this conversation of population growth and carbon emissions and growth in the global south, when we have really robust data that emissions in these areas are much lower. And actually we need to have more conversations about lifestyles in different places, and keep having an argument in those cases about people's bodily autonomy and what decisions they want to make. That's the conversation we should be having. So I think it shows that we can go backwards, and I use the basis of what has happened and the history of how we did come about family planning, birth control, and then family planning, and now contraception, and that whole process, to help people understand actually these arguments are the same, but the language changes.
Yeah, thank you for that really extensive answer. And so another question from the audience is, can any of the speakers address some of the particular needs or issues that adolescent girls and young women face?
I can respond to that. In the context where I work with adolescent girls, young women as part of the Athena network, I'm very careful to also not answer to just the issues they face. It's not just one issue. For example, a lot of the funding that has been driven currently, that's driving adolescent girls, young women programming, is on HIV, you know, and it's not really on HIV prevention. It's on HIV prevention, access, and treatment. But you find that it's a very limiting narrative. So I would want to say that during COVID, we have seen increased levels of gender-based violence. For adolescent girls, it's meant high rates of teenage pregnancy. We've seen, even after all these years of activism, for example, in Kenya, we did have an ARVs access crisis a few months back. And so I do think it's not just one issue. We've seen the multiplicity of that become even more. So it ranges from all forms of gender-based violence, teenage pregnancy, child early forced marriages, female genital mutilations. So I think it's not just one. I could put out a laundry list, but for me, it's really the issue of representation in these spaces. We still don't see girls and young women representing themselves in spaces. When they do, they are sort of, they're still being infantilized, where we are asking them to come and speak, but not end up at the final point of decision making. It's still not agency focused or that way. And even when discussing the sexuality, it's still very medicalized. We do not, for example, trust girls to venture into SRHR discussions in their entirety. So I'm cautious to say it's just one or two or these other issues, but I do think that there's value in us including girls and young women to self-represent, especially when discussing SRHR discussions, because also the evolution of the issues is really with them and they're organizing. I do think as an older young person, I cannot speak for a 23-year-old Kenyan person who lives in Nairobi. So, but I do think there's some issues to at least flag for context on this conversation.
Yeah, thanks for that great answer, Catherine. And so then another question that we have from the audience is, what do you see as key moments in the growth of the reproductive justice movement in terms of learnings about successful advocacy efforts?
So when you,
I can go.
Okay, go on.
I was just going to say that what excites me is the abortion rights movement and how I see, even though there's some regression in the United States, for example, as we've been watching and holding our breath and hoping, wishing the best, there's been some expansion of access, and different countries are expanding access, provisions for access on the continent. So, for example, Benin recently, Namibia, and that seems to be the most frontline uniting front for young feminist organizing on the continent. It really gives me excitement. And I think that also just kind of shifts the conversation from the usual discussions of CSE, and it really expands the frame quite more. And I think also looking at the same in Latin America and the Caribbean with the movements in Mexico, in Argentina, and other places, that really gives me some. And I think that is also a lesson for us to learn on framing and solidarity, and how we can all be mindful of supporting each other when folks are doing these kinds of work.
And just to bounce off of what Catherine said, I think that the infiltration of reproductive justice as terminology within a lot of the policy that we're seeing in the US is very exciting. You know, we have our first birth justice and climate change bill that is in Congress this year. And so some of the conversations that we're having around what formerly were conversations around reproductive rights are now being conversations around reproductive justice and the ways that reproductive choice interacts with race and other systemic oppressions. So I think that that's very exciting and heartening.
And just to add on top of that also, so I found quite heartening over the last year that finally within a UK context, but we've also seen it on a global scale, more attention has been paid to the Black maternal mortality gap, both local and global, and people having conversations about how racism, particularly in the global north, where Black people are in a minority, feeds into some of those statistics. So in the UK, the Royal College of Obstetricians and Gynecologists now have a race equality task force as of the last 12 months. And for us, these are new conversations, they're monumental conversations, and we have organizations that are really doing that work, and we're having more conversations about using tools that have their basis in other cultures, like doulas, which obviously have been around for centuries and have an extensive history, but that role changing and really talking about how it can address some of these racial inequalities. So I think that's really powerful. I'd also say that there's been a lot of changes to how people talk about female genital cutting, and over the last few years, and that's partly where I started a lot of my SRH advocacy as a medical student, and seeing people that have experienced FGC come to the fore and actually be able to design their own interventions, get their own qualifications, and be given more of a platform rather than being talked about, I think has been progress. A lot of the conversations has headed in the wrong direction in some areas, but I think there has definitely been progress if you look at that conversation over the last kind of 10-15 years.
Yeah, so thank you all for those great responses. And so unfortunately, we are out of time. So just wanted to give the floor to all of our panelists for any last thoughts and things that they want to make sure is said, and then we will wrap up this conversation.
I can start. Thank you so much, Sarah, for this platform and this conversation. I know this couldn't have happened without you, and I'm really thrilled to see the ICRW publication and see the audience's responses to it. I think this conversation around reproductive justice and racial justice really needs to continue, and I hope that this is a framework that a lot of NGOs and US government can consider, maybe not adopt, considering who the actors are, but consider and bring in some of the organizations and people such as the people on this coalition in this space into the room so that we can share our perspectives and ideas. So thank you so much.
Yeah, I'm happy to go next. So just thank you so much for curating this space and sharing such wonderful discussion. I think the final thought for me is just like consistently reproductive justice allows you to interrogate, and I think don't take anything as a given. For me, I'm constantly interrogating and still learning. So when I look at simple things, even like the measure of or what we're measuring and how we're measuring it, and thinking about how we decided upon these measurements or who put them there in the first place, rather than just writing your report and using those measurements. Ask deep questions about where they came from in the first place and who they're serving, and whether we can do that better. And that's how we're going to get to better solutions. Take nothing as a given, take nothing for granted, and I think that's how we're going to progress. And form coalitions. Please talk to more people outside of your networks and look for more people, and I can be better at that as well.
Thank you all for joining us today. And as mentioned previously, a recording will be shared out, and we'll also be sharing out ICRW's newest brief on the intersections of racism, colonialism, and sexual reproductive health and rights. And so with that, our conversation concludes. And so we hope you have a great rest of your day. Thank you all.